Hello, a very good evening. I am Dr. Nilesh Balkawade, Clinical Head, Oasis Fertility, and Regional Medical Head for Oasis Fertility. Today, we are going to talk in this month about recent advances in ART and how we are improving our results with these recent advances. And the topic or the subtopic for today is embryoscope or time lapse imaging. Friends, when it comes to selecting a good embryo for embryo transfer, there are different techniques which are available. One of these techniques is morphological assessment or looking at the embryos, their pictures, and their morphological assessment to select the good quality embryos. This is called as Gardner's classification. According to this, the embryo can be graded as grade a, grade B, or grade C. Again, you have some numbering given to the embryo. Often, while doing IVF, you will come across these words that the embryo grading for a blastocyst is 4AA or 5AA or 4AB or 4BB and so on. So, all this depends upon how much the numbering is for how much the expansion of the blastocyst is there. So, accordingly, 1 to 6 numbers are given. Then the grading is for the inner cell mass and the trophoectoderm. So that will depend upon that will give us the grading A or the grading B. That will give that will be dependent upon the trophoectoderm and the inner cell mass. So with this, while giving this grading, we also see for any fragmentation, then the peculiarity of the cells and all these aspects are studied, although all this is very subjective and sometimes there can be changes according to the person who is doing this grading. So again, it's a very good method because it's an age old method, but still it is used very widely. Other method for embryo selection for transfer is where you can do a embryo biopsy, and this embryo biopsy can be sent for examination, the trophectoderm biopsy, and we can do a pre-implantation genetic testing of the embryo for aneuploidy, where only euploid embryo is selected for transfer and all the aneuploid embryos can be segregated. So the report can be either euploid embryo, low mosaic embryo, high mosaic embryo, or aneuploid embryo. The aneuploid is classified as simple or complex aneuploid. So accordingly, the embryo can be selected. The next method is non-invasive PGT or NIPGT, where the apoptotic cells of the embryo, which are there in the media, culture media, without taking a biopsy, we can send these cells for examination, and this will give us the genetic report whether the embryo is euploid or not. The next method is AI dependent method where artificial intelligence is used to select the embryo. Here we select multiple images of the embryo, feed it to the software, and the software tells us which embryo amongst the lot is the best embryo or a euploid embryo for transfer. Other than this, sorry, other than this, you have uh, embryoscope which are available. So we have this time lapse imaging system where the embryos are placed in a separate incubation chamber which has got facilities for recording images and videos of the embryo, and these multiple images are then taken up and a video is streamlined where we can see the development of the embryo according to the time imaging. So this is called as time lapse imaging, where at a particular moment of time, if the embryo is correctly growing according to time, that indicates that the embryo has high chances of euploidy. And if an embryo is lagging behind in time, then that indicates that chances of aneuploidy are more in such embryos. So time-lapse imaging system is come up a long way, and there are newer and newer embryoscopes which are being available. So it also decreases the need of removing the embryos outside to see under microscope. All the images are available in the software. So a completely closed culture can be available. So right from the start, you have placed the embryos for culture till you are taking out the embryos either for transfer or for freezing. These embryos can be kept for uninterrupted culture without even disturbing them, and this again gives a major advantage. Also, time lapse imaging system, these have certain algorithms, certain things which help us, which are again AI driven, which help us to select the best embryo, and the need for PGTA or invasive testing is goes down. So, friends, it's just the start of newer technology being entering into the health sector, and this newer technology has also reached the IVF services. If you want to hear more about such more and more newer technologies which are followed at Oasis Fertility, please consult any of our fertility specialists at Oasis Fertility across all India, or you can directly visit me at Oasis Fertility Pune. We have two centers in Pune, Oasis Fertility at Wakad and Oasis Fertility at Kharadi. So do visit for any of your queries related to advanced IVF. We have these multiple options available which can make your life easy and which can increase the success rate even in the first go. So wish you all the best and do connect to us for any of your queries. I sign off for today. Thank you. Thank you.